Hi, my name is Jennifer Cooper, and today I'll be presenting my project on how digital health can be used in primary care to improve colorectal cancer screening in Arkansas. First, I'll briefly discuss why colorectal cancer, or CRC, remains an important public health issue and why Arkansas experiences worse outcomes than the national average. Then I will introduce the proposed digital health intervention, review the evidence supporting it, and finish by discussing implementation considerations and why this project matters for future practice. CRC remains the second leading cause of cancer-related death in the United States, with nearly 160,000 new cases expected this year. The encouraging part is that it is also one of the most preventable cancers because screening can identify and remove precancerous polyps before cancer develops. Even though screening is recommended beginning at age 45, participation is low, especially in federally qualified health centers, or FQHCs. So this problem isn't just that we don't have any effective screening tests. The problem is that too many eligible patients never complete them. Unfortunately, Arkansas continues to have higher CRC incidence and mortality than the national average. Many of the same barriers we see in other chronic diseases are present here as well, including rural geography, transportation challenges, limited preventive care access, and lower health literacy. Together, these barriers make it more difficult for eligible patients to complete recommended screenings. To better illustrate the problem, I'd like to introduce Jane. Jane is not a real patient, but she represents many average risk adults seen in Arkansas primary care. She's 52 years old, lives in rural Arkansas, works full-time on her family's farm, and rarely becomes sick. Because she does feel healthy, she has not established routine preventive care and is unaware that CRC screening now begins at age 45. Jane is not refusing screening. She simply has not had anyone reach out to her to let her know that she's due. So the question becomes, when will Jane actually be screened? So this is how CRC screening typically works today. Everything starts with the patient coming into the office. So it is primarily visit-based. If they don't schedule a preventive visit, there's often no opportunity to recommend screening. Even after a referral is placed, patients can still be lost somewhere along the process. Sometimes the scheduler cannot reach the patient, or the patient and scheduler never connect to schedule the screening. Then there is no follow-up if the patient does not complete the ordered screening. Looking at this workflow, there are several points where eligible patients can fall through the cracks, and that is the gap that this project is trying to address. So this project aims to improve the current process using digital health technologies that many clinics already have to make CRC screening more proactive. Instead of waiting for patients like Jane to schedule an appointment, the electronic health record, like Epic, identifies adults between the ages of 45 and 75 who are overdue for screening. Once those patients are identified, MyChart, which is the patient portal, sends them evidence-based education about CRC screening, along with a reminder that they are due. Patients can then review their screening options on their own time and schedule the test that is most appropriate for them. And if they have any questions, the integrated telehealth feature of Zoom in MyChart provides another way to connect with their provider. Overall, the goal is to make screening scheduling easier by reaching patients before they're lost to follow up, rather than waiting until they have to come into the office. Evidence and studies show that this intervention actually works. These are just a few studies I included in my literature review that consistently showed that digital health tools improve CRC screening participation. Whether it was through patient portals, electronic reminders, mailed fit outreach, or patient education, Each study demonstrated improvements in screening adherence. Combining these evidence-based strategies into one workflow could be an effective approach for primary care, especially within FQHCs. The good news is this intervention doesn't require most clinics to build an entirely new system. Many healthcare organizations already use Epic, MyChart, and the integrated Zoom for healthcare. So the technology is already available. The focus becomes integrating these tools into a workflow that proactively identifies patients who are overdue for screening. Of course, there are still important considerations. Reliable internet access is necessary for many digital health services, although audio-only visits can still improve access for those who do not have access to a computer or internet. Organizations also have to ensure HIPAA compliance. That's through secure platforms, encryption, and patient education. And finally, successful implementation depends on financial support. And Arkansas, fortunately, already has reimbursement mechanisms for the screening and funding opportunities, such as Thrive, which can help support digital health initiatives. So knowing this, let's go back to Jane. So without this intervention, she may continue to go years and years without visiting her PCP, meaning that she will never receive a recommendation for CRC screening. By the time symptoms develop, opportunities for prevention have already been missed, increasing the risk for late detection and higher mortality. With this intervention, however, Jane is automatically identified as someone overdue for screening. She'll receive that education, and she will schedule and complete her screening before symptoms have even developed. And if abnormalities are found, appropriate follow-up is arranged. The important difference is that Jane didn't change anything. The healthcare system instead made it easier for her to receive the recommended preventive care. This approach has the potential to improve screening across an entire patient population. By identifying patients earlier, making screening more accessible, healthcare organizations can improve adherence to evidence-based screening recommendations. That creates more opportunities to remove precancerous polyps, detect cancer at an earlier stage, and ultimately improve health outcomes while reducing the burden of CRC. With anything, of course, there are limitations. Not every patient has reliable internet access or feels comfortable using digital health technology, particularly in some rural areas. Digital health also can't completely eliminate barriers such as transportation, financial concerns, or limited healthcare access. On the organizational side, implementing a project like this requires staff training, workflow changes, and commitment to conduct ongoing evaluation to make sure it's actually improving screening rates over time. As future nurse practitioners, this project highlights an important shift in primary care. Our role isn't just treating disease after it develops. We're also responsible for improving preventive care, identifying care gaps, and finding ways to better reach our patients. Digital health is a tool we can use to accomplish these goals. By using technology that's already available, APRNs can improve screening adherence, increase patient engagement, and hopefully reduce some of the health disparities we continue to see, especially in rural communities like many areas of Arkansas. I'd like to finish with a few thoughts to consider. Could a proactive digital health model like this work in your future practice? If CRC screening isn't the best fit for your specialty, could the same approach be used for another preventive screening program or chronic disease? What barriers do you think would be the most difficult to overcome when implementing a project like this? And what changes would you make to strengthen the intervention before putting it into practice? Finally, I've included several resources that I found helpful while researching this project, including the American Cancer Society, the USPSTF, the Center for Connected Health Policy, and Arkansas's Thrive program. These are all excellent resources for current screening recommendation, telehealth policies, and implementation information. Thank you so much for your time and attention. I am happy to answer any questions. My references are included on the slides to follow.